Picture this. It's 7 o'clock in the evening. You're in your favorite chair, the one that fits your body like it was built for you. You've been sitting there since lunch, and you feel it, a tightness in the back of your calf. Not sharp, not dramatic, just tight, like you slept on it wrong. You rub it, tell yourself it's nothing, maybe walk it off. 2 hours later, you're gasping, your chest crushing from the inside, and your family is calling 911. This isn't a rare story. It's what a silent blood clot does when it goes unrecognized. It starts as a whisper in your calf, and it can end as a scream in your lungs. Before we go further, one quick note. I'm sharing medical education here, not a diagnosis, so anything that sounds familiar today deserves a real conversation with your own doctor, or a call to 911 if it's urgent. The medical names are deep vein thrombosis, or DVT, and pulmonary embolism, or PE. A DVT is a clot deep inside a leg vein. A PE is what happens when a piece of that clot breaks free, travels through your bloodstream, and lodges in your lungs. One is a warning, the other can be a catastrophe. And the terrifying part is this: the warning almost never announces itself as an emergency. It disguises itself as something ordinary, a charley horse, a pulled muscle, bad circulation from cold weather, just getting older and out of shape. Here's what should concern every person watching this, especially if you're over 60. The habits that feel completely harmless are exactly the conditions a clot needs to form. Sitting for long stretches in a recliner or on a long car ride, not drinking enough water, recovering from a recent surgery or hospital stay, even a long flight. These aren't dramatic risk factors. They're ordinary Tuesday afternoon life, and that's exactly why so few people see this coming. By the end of this video, you'll know the 5 ways a silent clot disguises itself as everyday muscle pain, the biological reason your veins grow more vulnerable with age, and exactly when each symptom crosses the line from "keep an eye on it" to "call 911 right now." Symptom 3 is the one almost nobody connects to their legs at all, so stay with me. Let's talk about how a clot actually forms. Back in the 1800s, a pathologist named Rudolf Virchow identified 3 conditions that together create the perfect environment for a dangerous clot. Doctors still call this Virchow's triad. The 3 conditions are stasis, endothelial injury, and hypercoagulability. Stasis simply means blood that isn't moving the way it should. Think of a river dammed up into a stagnant pond. Sediment settles, the water turns thick and murky. When you sit for hours without moving your legs, the muscles that normally squeeze your veins and push blood back toward your heart go quiet. Blood pools in the lower legs, slows down, and gets the time and opportunity it needs to start clumping together. Endothelial injury refers to damage to the smooth inner lining of your blood vessels, like a rough patch inside a brand new water pipe. Surgery, injections, inflammation, or simply decades of wear and tear can create that rough patch, and platelets and clotting factors start sticking to it, the same way a rough patch inside a pipe attracts mineral buildup. Hypercoagulability just means your blood has become more prone to clotting than it should be. This can happen from dehydration, which thickens your blood the way a smoothie thickens with less liquid, from certain medications, some illnesses, or genetic factors you were simply born with. Here's why this matters more as we age. Your veins, when you were young, had incredible elasticity, like a brand new rubber band snapping back into shape instantly. Inside them are tiny one-way valves whose entire job is to stop blood from falling backward as it fights gravity on its long journey up from your feet to your heart. In your younger years, those valves snapped shut with precision, like perfectly fitted doors. Over decades of use, veins lose that elasticity, the same way an old rubber band goes soft and stretchy, and those valves can weaken, becoming loose, sometimes failing to close completely. When that happens, blood doesn't just slow down, it literally falls backward, pooling in the lower legs, sitting there, stagnant, thickening. Combine that natural age-related vein weakness with something like a long car ride, dehydration, or a recent surgery, and all 3 sides of Virchow's triad activate at once. That pooled blood begins to gel, not all at once, but layer by layer, until it forms a solid mass inside the vein, a clot, a loaded weapon waiting for a piece to break free. This is why I need you to know these 5 symptoms cold. Symptom 1, the one-sided deep calf achiness. The deceptive myth is that it's a charley horse, or you overdid it on a walk, or your shoes were wrong. It's dismissible because it's just an ache in one leg, but underneath, a clot deep in the calf vein is obstructing blood flow, and the vein wall becomes inflamed as your body reacts to what it perceives as an injury. That inflammation irritates nearby nerve endings, producing a deep, constant throb, fundamentally different from a muscle strain, which hurts with specific movements and eases with rest. A DVT ache often worsens when you flex your foot upward, stretching the irritated vein underneath. I once saw a patient I'll call Robert, 71, a retired postal worker who described the world's most stubborn Charlie horse for 4 days, tried stretching, heating pads, even muscle rub. What caught my attention was that his right calf felt heavier than his left, like he was dragging a small weight around all day. On exam, that calf was noticeably firmer to the touch, and flexing his foot upward toward his shin made him wince sharply. An ultrasound confirmed a DVT. He started blood thinners and made a full recovery, with follow-up imaging confirming the clot had dissolved. Your at-home check. Sit down on the edge of a bed or a sturdy chair and compare both calves side by side, visually and with your hands. Press gently into the muscle of each. A muscle strain is usually tender in one specific spot without a size or firmness difference between legs. A clot-related ache often shows one calf that's visibly firmer, sometimes subtly larger, uncomfortable in a broad, deep way rather than one tender point. This is an observation tool, not a diagnosis, and it's not a substitute for a professional evaluation. Emergency threshold. If that ache comes with any swelling, warmth, or redness, or lasts more than 2 to 3 days without an obvious cause, call your doctor the same day. If it's ever joined by sudden chest pain, shortness of breath, or a racing heart, call 911 immediately. That combination can mean a piece of the clot has already reached your lungs. Symptom 2. Unexplained warmth and unilateral swelling. Seniors often blame this on ordinary fluid retention, which usually affects both legs evenly, or a mild sprain. But a clot-caused swelling behaves differently. Fluid that should be returning efficiently to the heart instead leaks into the surrounding tissue, almost always in just one leg. The warmth comes from your body's inflammatory response working overtime nearby, immune cells rushing in, local blood vessels dilating, generating heat you can actually feel. I treated a woman I'll call Patricia, 68, an avid gardener who assumed she'd overdone it, reaching for the hose. Her left leg from knee to ankle was visibly more swollen than her right, and pressing the back of my hand against each shin revealed an obvious temperature difference. We measured a full 3-centimeter difference in calf circumference, and an ultrasound revealed an extensive DVT. She was hospitalized, treated aggressively given the size of the clot, and recovered fully. Your at-home check involves both your eyes and your hands. Stand in front of a mirror or have a family member look and compare the 2 legs. Is one ankle noticeably more swollen than the other? Press the back of your hand, more sensitive to subtle temperature changes than your palm, against the skin of one shin than the other. A warmer, more swollen leg on just one side, without an obvious cause like a bruise or a bug bite, deserves attention. Emergency threshold. Unilateral swelling and warmth developing over hours to a couple of days, especially after surgery, hospitalization, or prolonged immobility, warrants same-day evaluation. Severe swelling, deep red or purplish discoloration, or fever means an urgent same-day ER visit. Symptom 3, and this is the one I most want you to remember: deep, fleeting twinges in the shoulder blade or ribs. The myth makes perfect sense on the surface. You slept wrong or pulled something reaching for a cabinet. Nobody connects a twinge near their shoulder blade to a clot that started in their calf days earlier. Here's the mechanism. When a small fragment breaks off a deep vein clot, it travels through the venous system, through the right side of the heart, and lodges in a smaller branch of the pulmonary arteries in the lungs, a pulmonary embolism. Not every PE causes the dramatic, crushing chest pain most people expect. One lodging near the outer edge of the lung, close to the pleural lining, can cause sharp, brief pain referred to the back, shoulder blade, or ribs because of how those nerves are wired. It often worsens with a deep breath or a cough, then fades within moments, only to return. That fleeting quality is exactly why people dismiss it. I saw a patient I'll call Harold, 74, a former high school teacher, about 10 days after knee replacement surgery, describing a nagging crick between his shoulder blades that he blamed on sleeping in a recliner during recovery. He mentioned, almost in passing, that it seemed to catch him more sharply when he took a deep breath or laughed at something on television, Given his recent surgery, a major risk factor for clot formation due to prolonged immobility, that detail was a red flag I couldn't ignore. I sent him for imaging immediately, which revealed several small pulmonary emboli in the lower lobe of his right lung, having traveled from a DVT that had formed silently in his surgical leg. He started anticoagulation and made a complete recovery, though it was a sobering reminder of how easily this could have been missed. Your check here is mental, since there's no safe physical test for a lung-based clot at home. Did this twinge appear with no clear injury? Does it worsen distinctly with a deep breath or cough? Any recent surgery, hospitalization, or long trip? 2 or more yes answers matter more than the pain's location or intensity. Emergency threshold: any new chest, back, or shoulder blade pain that worsens with deep breathing, especially paired with shortness of breath, a racing heartbeat, or lightheadedness, warrants an immediate call to 911. This is not a symptom to wait out overnight. Symptom 4: sudden, episodic dizziness and shortness of breath during basic tasks. The myth is one of the most common in senior health. You're winded walking to the mailbox, a little lightheaded, and you assume you're simply out of shape. But when a clot partially blocks blood flow to a portion of lung tissue, that tissue can't properly exchange oxygen, even though it still fills with air. Your heart works harder, and your breathing rate rises to compensate, producing breathlessness and dizziness disproportionate to the activity. Sudden, not a slow decline. I treated a man I'll call Dennis, 69, a retired accountant who told me, almost sheepishly, that he'd started pacing himself on his daily walk to the corner and back, something that had never bothered him before. He described 2 specific episodes over the past week where he'd had to stop and sit on a neighbor's low wall because he felt his heart racing and the world tilting slightly. He'd chalked it up to the summer heat. What stood out to me was the suddenness and the specific episodic nature of it, rather than a slow, gradual decline in stamina. Testing revealed a moderate pulmonary embolism traced back to a previously unnoticed DVT in his left thigh. He was hospitalized for monitoring, started on anticoagulation, and his breathing and energy returned to their normal baseline over the following weeks. Your check: did this develop slowly over months, consistent with deconditioning, or appear suddenly within days during activities that felt fine last week? Is it paired with a racing heartbeat or real dizziness, not just generic tiredness? A sudden change is a fundamentally different pattern than simply being out of shape. Emergency threshold: any sudden new shortness of breath during previously normal activities, especially with dizziness, a racing or irregular heartbeat or chest discomfort, needs urgent same-day medical attention. Severe breathlessness or fainting is a 911 call, immediately. Symptom 5: pale or bluish foot discoloration with a weak pulse. The myth is seasonal, poor circulation, or just cold weather affecting the extremities. This one is genuinely different from the first 4. The others involve venous clots, blocking blood returning to the heart. This is an arterial clot, blocking oxygen-rich blood from actually reaching the foot. Tissue starved of that supply can suffer real, sometimes irreversible damage within just a few hours. The pale or bluish tint reflects tissue not receiving adequately oxygenated blood, and the coldness reflects warm blood simply not reaching the area. I saw a man I'll call Walter, 78, whose daughter noticed his right foot looked grayish at a family dinner. He chalked it up to poor circulation, like his father before him. His pulse at the top of that foot was remarkably faint compared to the strong pulse on his left, and the foot was noticeably colder. This combination, pale or bluish color, coldness, and a weak or absent pulse, is a hallmark of acute arterial insufficiency. He went for emergency vascular imaging that same hour and had the clot removed before permanent damage occurred. Your at-home check: compare both feet in good lighting for color and temperature. Touch the tops of both feet to compare. If you or a family member knows how, gently check the pulse on top of each foot, roughly between the big toe and second toe, and compare strength side to side. Emergency threshold: a pale or bluish foot, cold to the touch with a weak or absent pulse, is not a call your doctor tomorrow situation. This can represent a genuine limb-threatening emergency. Get to the ER right now. Now let's talk about how to meaningfully lower your risk starting today, because prevention here is genuinely powerful. If you're going to remember one number from this entire video, let it be this: aim for roughly half your body weight in ounces of water daily. adjusted of course for any fluid restrictions your own doctor has given you, because thicker, more concentrated blood is measurably more prone to clotting. If you're sitting for extended periods, whether it's watching television, working at a desk, or on a long car ride, commit to doing ankle pumps, simply flexing your foot up and down as though you're pressing a gas pedal, 10 to 15 repetitions every 30 to 60 minutes. This single habit mechanically forces your calf muscles to squeeze those veins and keep blood moving, directly counteracting the stasis we talked about earlier. If you've had recent surgery, a hospital stay, or you know you'll be on a long flight or car trip, talk to your doctor specifically about graduated compression stockings. These aren't the loose decorative socks from the pharmacy aisle. Properly fitted compression garments apply calibrated pressure that genuinely assists venous return, and your doctor or a specialty fitter can help you get the correct size and compression level. And if you take any blood-thinning medication, take it exactly as prescribed at the same time each day, and never adjust or stop that dosage without speaking to your doctor first, even if you're feeling completely fine. Your body rarely screams before it whispers first. A deep clot doesn't typically announce itself with a siren. It announces itself with a slightly heavier leg, a fleeting twinge near your shoulder blade, a foot that looks just a little off in the evening light. Trust those whispers. Compare both sides of your body regularly and talk to the people you love about these 5 signs, because they may notice something in you before you notice it yourself. If anything here resonates with what you or someone you love is experiencing right now, please don't wait for a future appointment. Contact your doctor today or call 911 if it matches one of the emergency thresholds I described. If this helped you understand your body a little better, drop vitality in the comments. If you're committing to your ankle pump starting today, hit subscribe so you don't miss information that could genuinely add years to your independence. And share this with the person in your life who sits the longest, travels the most, or has had a recent surgery. I'm Dr. David Thompson. I'll see you in the next video.